Welcome to this introductory video on trauma assessment, where we'll review the structured approach to managing trauma patients as outlined by Advanced Trauma Life Support, or ATLS. This approach is essential in emergency settings to systematically address life-threatening conditions and stabilize the patient. The general approach to trauma follows a structured and prioritized assessment process to maximize patient outcomes. Trauma care starts with the primary survey to quickly identify and manage any life-threatening conditions. This is followed by adjunct assessments to support immediate interventions, and then a secondary survey to identify other injuries. This systematic approach helps ensure thorough and consistent care. Let's dive into the primary survey using the ABCDE method to address each major component in order of priority. A. Airway with cervical spine control. The first priority in trauma is to confirm that the airway is clear and open. Listen for abnormal sounds such as stridor, gurgling, or complete silence, which could suggest an airway obstruction. If there is an obstruction, perform suctioning or insert an oropharyngeal or nasopharyngeal airway to maintain patency. Be prepared to intubate if required. Assume every trauma patient has a cervical spine injury. Stabilize the neck manually and apply a rigid collar. Remember to maintain spinal precautions throughout the assessment. B. Breathing and ventilation. So for the assessment, observe the chest for symmetrical rise and fall, respiratory rate, and signs of respiratory distress. You should look for accessory muscle use, cyanosis, or asymmetry. When it comes to palpation and auscultation, palpate for any tenderness or crepitus, and auscultate to check for equal breath sounds on both sides. Absent or diminished breath sounds could indicate conditions like pneumothorax or hemothorax. Now, for interventions, if breathing is inadequate, provide supplemental oxygen. And in the case of attention pneumothorax, immediate needle decompression may be necessary, followed by chest tube insertion. C. Circulation with hemorrhage control. For the assessment, evaluate circulation by checking for a central pulse, such as the carotid, and observing for signs of shock, like pallor, altered mental status, or delayed capillary refill. When it comes to hemorrhage control, stop any external bleeding using direct pressure, hemostatic agents, or tourniquets as needed. For volume resuscitation, establish 2 large-bore IV lines, 16 gauge or larger, and begin fluid resuscitation with crystalloids. If hemorrhagic shock is suspected, initiate blood transfusions according to protocol. D. Disability, which refers to the neurological status. Quickly assess the patient's mental status using the AVPU scale: alert, response to voice, response to pain, or unresponsive. Alternatively, you can use the Glasgow Coma Scale, or GCS, for a more detailed neurological assessment. Check pupil size and reaction to light. Unequal or fixed pupils can indicate increased intracranial pressure or traumatic brain injury. Lastly, assess for limb movement and lateralizing signs, which may indicate spinal cord or brain injury. Exposure and environmental control. Full exposure. Fully expose the patient to identify any hidden injuries. Be cautious to inspect the back and posterior surfaces by carefully log-rolling the patient, always maintaining spinal precautions. Environmental control. To prevent hypothermia, which can worsen trauma outcomes, cover the patient with warm blankets immediately after the examination. Use warming devices or warmed IV fluids as needed. Section 3. Adjuncts to the primary survey. Following the primary survey, adjuncts can help confirm diagnoses and guide further treatment. Portable imaging. Quick imaging like a chest X-ray or pelvic X-ray helps identify fractures or fluid collections. Fast or focused assessment with sonography for trauma. This ultrasound scan detects free fluid in the abdomen or pericardial sac, which may indicate internal bleeding. Laboratory tests. Obtain blood for typing and cross-matching, hemoglobin levels, and arterial blood gases to guide immediate resuscitation efforts. Section 4. Secondary survey head-to-toe assessment. Once life-threatening issues are stabilized, perform a secondary survey for a thorough head-to-toe assessment. This identifies any remaining injuries, head and neck. Inspect for scalp lacerations, fractures, or neck deformities. Chest. Check for fractures, bruising, or other signs of thoracic injury. Abdomen. Palpate for tenderness, distension, or rigidity, which could indicate internal injury. Pelvis and extremities. Assess for fractures, dislocations, or vascular compromise in the limbs. neurological evaluation, reassess motor and sensory function, noting any changes since the initial assessment. Closing shot emergency department. Text overlay. Stay systematic, stay prepared. In trauma management, a systematic approach saves lives and minimizes missed injuries. By following this ABCDE framework, you'll be equipped to provide effective and efficient care for trauma patients. Thank you for watching, and let's keep building skills to make a difference in emergency care.